Only 4 days after critical care nurse Nina Pham was found to be infected with Ebola, a second healthcare worker has been diagnosed with the deadly disease. The hospital staffer at Texas Health Presbyterian is one of the 76 healthcare workers who provided care for the now deceased Ebola patient Thomas Duncan.
The second Ebola case in Texas now stirring up plenty of questions and a lot of concern. And the World Health Organization now estimating the disease death rate could be 70% and growing. Even more alarming, the number of new West African cases could reach 10,000 a week by December. Is this just the new normal? And what about the CDC? We've got questions. Welcome back to MidPoint. Popular author of the Washington Post's The Right Turn blog, Jennifer Rubin joins us on MidPoint. Jennifer, pleasure to have you on the show. Thank you.
Nice to be here.
Let us talk specifically about the CDC. First up, here we have an Ebola patient flying the day before symptoms. That's the second patient. We have nurses right now who are coming out and saying there were no protocols for us to get ready. And we have a director who is almost, it seems, changing a story or at least improving on it every single day. Do we now have to just stop in our tracks right now and say that as we see it, the CDC is completely and totally incompetent in what they're doing?
Well, I think they are certainly overestimating the ease with which this is going to be stopped. What happened was this was another one of the healthcare workers in Dallas who had treated the first Ebola patient, and this person got on a plane contrary to, I guess, protocol, which they now question whether there really are any, and is now under care. The real question, and I think what is going to either calm the public or set off a panic like nobody's business, is whether anyone on that airline on which the healthcare worker was flying is infected. Until now, we've simply had person-to-person contact. This would be the first case in which someone in contact with an Ebola patient carrying the disease then went and infected other people. If that's the case, people are going to get very, very nervous because obviously then you have to look at all those people in the airline and all the people in the airline had contact with, and so on and so forth. So we have not had that today. CDC says, and a number of experts say, that this sort of contact is unusual, but unusual obviously is not completely calming because unusual things happen all the time. I think how this plays out is going to be quite interesting, and I think what we have learned is that it is much harder than the CDC says it is to get hospitals to fully comply with these protocols. They weren't followed, as you referred to. There was scotch tape to, keep their gowns and materials together, all sorts of sloppy practices, and obviously that hospital and every other one that treats these people is going to have to completely button this up.
Well, let's talk about that a little bit when it comes down to the media reporting on this story. When the first patient died in Dallas, the media was very quick, much of the media, to jump on the fact that the family and people had said that because he was black, he didn't get the proper care, that they shoveled him out of the hospital as quickly as possible. Now we're hearing there were over 70 people involved, and some of the nurses there are alleging that some of the bedding, thanks to projectile vomiting and other bodily fluids that were in the emergency room, were literally stacked to the ceiling in a lot of cases here. So doesn't this tell us that we're jumping here? The media is helping to fuel this in many ways because they're throwing out so much incorrect information. They're not waiting.
Yeah, I think the tendency is to take every rumor and take every snippet of information and elevate that and then replay it over and over and over again. We see this with every breaking crisis or news event. You saw it, for example.
And it's politicized in many ways, is it not?
It is, because it depends upon, who's slaying who. You had left-wingers saying, well, look, it happened in a red state of Texas.
Exactly.
As if that has something to do with it. But what it does, I think, is it does play into this sense that whatever the government is saying, you really shouldn't believe it entirely. And this is both what conservatives have cautioned for years, but on the other hand, it is a bad thing when nobody believes what they're being told. In some cases, even if they're being told correct information. And you do then have panic. You do then have people behaving in ways that are not productive. So I think if we had better leadership, I understand the president actually canceled a fundraiser.
Well, hold on one sec, because I'm out of time here, but we're going to take a break and come back, because you hit right on where we're going to go ahead and start out the next segment here when we talk about this. Jennifer Rubin will join us after the break when we talk about the Obama administration and also a couple of events that the president missed because of what's happening in Dallas. Also coming up later on this hour, the call is out. This is the most dangerous stock market since 2008. That and much more coming up right here on MidPoint.